I see it's 5 o'clock. I'd like to call the meeting to order of the Health and Human Services Board on March 19th at 5 p.m. at the Government Center at room 1400. Roll call, please.
Greg Talajon.
Present.
Sean Anderson is excused, right?
Yep.
Mike Barkalow.
Present.
Kathleen Finley. Kathy Leaf.
Present.
Lisa Lind.
Present.
Deb Lindeman.
Present.
Dave Osnes is excused. Julie Smith.
Present.
We have a quorum. There was minutes in the packet. Is there any additions, corrections, or revision? Hearing none, they'll stand approved as presented. Any public comment tonight? Any public comment? Public comment? Okay, thank you. Business item, financial report for February 2025.
Good evening. Tonight we have our financials through February of 2025. We're just starting to see our local revenues coming in. Very few state revenues have come in. We're just now submitting those expenses from January and February, and we'll see those coming in next month. Otherwise, for the most part, our local revenues are trending very similar to where they were last year at the same time. Our 2024 revenues, we will have a few more coming in that's coming in yet this year that will get posted back to last year, so we'll continue to see that change as the months go on here through May. I didn't really have anything to point out for Health and Human Services. Did anyone have any questions on them? Otherwise, I'll just go over to the healthcare campus. Okay, so our healthcare campus, if you look at them, they are trending above where they were last year. So we have opened up Kitty Roads. I believe there is one admission there, so we're starting to see revenue. Well, we will see revenue from there. We have higher census than we had last year at the same time, and our Medicaid rates are higher than they were, so we'll continue to see that trend as we go on. We did just start our nursing home audit, so auditors are doing a lot over remotely, but they'll be on site tomorrow, and then we'll probably see adjustments to our healthcare campus if auditors find anything that needs correcting. Expenses. I'll get down here at the health or nursing home. So we did see our salary and fringe is higher than it was last year at this time, but then you'll see the pool staff also drop down a little bit. So as we're getting more staff hired, we'll see the pool staff drop and the salary and fringe increase. Again, that salary and fringe will also increase as census is higher. So they will up or have staff working as needed to go with the census. Because the nursing home did finish positive last year, they did do the transfer to the debt service of $250,000 for the skilled nursing facility, and then they also did a $250,000 adjustment for Orchard View Terrace. Any questions for me on healthcare campus? Okay. And then veteran services. And again, they're trending very much on track, similar to last year at the same time. That's all I've got for you.
Anybody else have any questions? Thank you. Update on family treatment court grant.
Mr. Chair, I asked Jessica Dodge from Children's Services if she would come and talk a little bit about the Family Treatment Court grant that we received and give us a status update.
Yes, thank you, Bob, and thank you, Mr. Chair. My name is Jessica Dodge. I work in child protection, ongoing services, and supervisor under Children's Services. And Bob had asked me to come. I believe he had talked a little bit last meeting about that we had received the grant and that we've been working on how we can continue to support bringing down the cost of out-of-home care placements and maintaining kids in their home whenever possible. So I'll just be giving kind of a quick high-level overview of the grant that we received, what Family Treatment Court is, and where we're at in the process. Okay, so let's see if I can. A little background just to kind of orient everyone about what we've been working on. So this process started way back in October. We received information that the Department of Children and Families had released funding for human services agencies to apply to provide services to families under family treatment courts. This was to provide a new family treatment court program. There's currently 10 formal family treatment courts in the state. And so they were opening up funding to 2 counties to launch new programs. So myself, as well as Kim Kitzberger from Behavioral Health, she is currently in the substance use case manager position that was funded. I think you heard last year or last meeting that position was funded through the opioid settlement funds. She's providing treatment and services directly to our child protection population. We had worked together as a joint effort between Children's Services and Behavioral Health to apply for the funding. It was a lot of meetings. It was a big undertaking to decide, is this something we want to get involved with? There's a lot of planning involved. It's been something that we've talked about for a number of years, and that there's been some expressed interest in. Many years ago, I was involved in starting up a family treatment court program in Barron County, so that was something that's been of interest of mine. So the purpose of the program is to support families involved with child welfare who have moderate to severe substance use disorder needs. The idea is that it's a more comprehensive, coordinated approach to child welfare than we're currently able to provide under the structure that we have. So the idea is that we have more focused and intensive resources and supports funded through this model and fidelity of the program that help increase positive outcomes for families involved in child welfare, as well as improving stability of families and well-being of children. Okay, so kind of the nitty-gritty of it. This is state funds. That's everyone's question. Is this federal money? No, this is state money. The grant is for guaranteed 3 years with the potential for it to be funded for up to 5 years with the availability of funding. We receive technical assistance on implementation of the program from a number of agencies. And we've had an opportunity to talk with lots of people through the planning process. And what we're learning is that there's really a strong appetite for this type of program and continuing these programs in the state. So in terms of sustainability, I know that's always a county board concern. What is this going to cost us in the future when the grant funds run out? And the hope is that nothing. Other counties have been really successful in sustaining the funding through lots of different funding sources. So we're hopeful that that would continue to be the case for St. Croix County as well. All right. Okay, so just a quick overview of where we're at now. We're still very much in the early, I call it early implementation phase. This is kind of a long haul project. I would guess it will take a year or two to kind of figure everything out and bring the program to fruition. It's been a long 5 months of kind of determining if we want to throw our hat in the ring, writing the grant, receiving the grant, deciding, do we really want to do all this work? Is this something everyone's really buying into? Determining who our stakeholders are, looking at program structure, staffing, training, and then establishing the oversight structures that are required. So current status is early planning is still underway, even though we're 5 months in. We have not yet, I don't think, received the contract, actually, Faye. I don't know if you have an update on that, but we don't have a contract yet for DCF, so they're a little behind as well, but they understand that this is a big undertaking and it's going to take counties time to implement. So we look forward to continue to make decisions that hopefully will move the program forward. And the whole reason we do this is we hope to have a positive impact. So one, we hope that the program will have a positive impact on the families that we serve in child protection. And two, we hope that it's going to have a positive impact on the county. So research and evidence supports that these programs really help families overcome barriers that they have to reunification. Even though St. Croix County does pretty well in that category, last year we reunified kids 2 months sooner than the state average. There's still lots of room for improvement there. We hope that we can get families more timely services, that they can get the supports that they need to reunify quickly. And we know that if that happens quickly, it's more likely to happen in general. So the idea is that that'll save the county money in the long run. We also hope to be able to keep kids in home and provide them with the support and safety that they need to be able to stay in home long term. We don't want kids to be in foster care any longer than they need to be, but we also don't want them to come back. And so that's really the idea of this program is they might be involved longer and it might be more intensive, but the hope is that they also are returning to the child welfare system. And I know out-of-home care placement costs have always been a big topic of conversation at the HHS board meeting. It's a big budgetary concern, and so I know even though our out-of-home care numbers are going down, we continue to have high placement costs. The needs of families are complex, they're complicated, it's hard to get kids home with the varying needs that families have, and so the hope is that this really would help with all of those issues that we have as a county and to bring those costs down as well as kind of a final benefit to the county, as well as strengthening our overall child welfare system. All right, well, that was a mouthful. I included a link with a bunch of information. DCF has some wonderful resources on their website through this Family Treatment Court grant link. It talks about the funding structures, the statutes that we look at with this, the outcome reports from other programs that have implemented these programs and what the structures of those programs have looked like, as well as state and national resources. So if you get the time, look into it a little bit more. There's lots of information out there. And if you have any questions, I did put my information in the PowerPoint as well that's in your packets. And I'd be happy to take any questions that anyone has right now.
Did you say this is limited in the counties that are receiving this?
Yes, so we were one of 2 counties that received the funding. Eau Claire County was the other. So the Western regions really like representing with this Family Treatment Court effort. Barron County, Dunn County, and Jackson County also have programs out of the 10 in the state.
Oh. Anybody else have any questions?
Great work.
Thank you.
Yeah. Veteran Services update. We got Phil in the spotlight.
Would you like me to do it here, or do you want me to go up there?
We'd like to stare at you.
Okay. Take a good look. Here it comes. Yeah, this is, so Bob said that I had 45 minutes and I can't come underneath it. So I better, right? Okay. I'm just kidding. But for those of you who don't know me, my name is Phil Landgraf, and I'm the Veteran Service Officer for St. Croix County. I said this beforehand. I'll say it again. We like to try to stay under the radar as much as we possibly can. We just do our work. When you guys are asked to come down and give an update, we're more than happy to do that. But if we stay out of the way, that's a good thing. That's a win. It also is a good reminder that my blazer still fits when I come down. So thank you. Appreciate that. So I also spoke to Supervisor Dave Osnes on the way over here. I popped by, has nothing but great things to say about the care that he's getting there, and he's got big plans of coming down and trying to get into my office and rattle my cage sooner rather than later. So that's good. There has been some scuttlebutt, some things that you probably heard in the news about the VA, about some potential cuts. There may be some cuts that are on the way. I know that a lot of veterans are a little bit nervous. They're worried about the care. Biggest thing that they're worried about is obviously their VA disability benefits. There's a lot of folks that really live on that, and it's their lifeblood of them being able to thrive and to even survive in some cases. You know, I would say that I have seen some changes. There has been some elimination of some staff members in the benefits sections and stuff like that. They are forcing in home, or like the homework is no longer, telework is no longer an option. Starting in May, everybody who does VA benefits and things like that is going to have to go into the VA Whipple building, and they are mandatorily bringing them back. It's my understanding that supervisors and folks like that are already in, but this is for benefits. Obviously, the people that are doing VA healthcare, they have to be in person. They have to do those things in person. So that's kind of coming. The reason why it's taking so long is because they weren't in office for so long. They did other things with it, and now they actually have to get it back so folks can actually be in-house. Real quick question. How many veterans do you guys think are in St. Croix County? Give me an idea. 5,230. That's how much we have last. Of those 230, I swear sometimes we see all of them, you know, we do see that a lot. But of those people, with the veterans, their dependents, and all of the benefits that they bring in, there's over $61 million that come in 1 year from those 5,000, those veterans and all of their dependents, whether it be through VA healthcare, compensation and pension benefits, education. There's other things like that that are as well. So they bring in a lot of revenue to St. Croix County. So when they're doing well, St. Croix County is doing well. We actually have over $33 million in compensation and pension dollars from disabilities and stuff like that. One would say that maybe we're always trying to increase that. That's my staff's stated goal. We want to make sure that we get as many people linked into their services as possible. It is a process. So one of the things that we do is, like I said, we do VA disability claims. We help people out with VA healthcare, death benefits, education. There's a long list. There's 70 plus benefits that we have to know, retirees, all of those things. So we have to be well versed. I do have to say that I have a fantastic staff. Joe Angusether, Anna Anderson, they do great stuff, and we're 3 people, but we are a strong unit, and I really commend them for their work. They do great stuff. One of the things that you guys know, it's almost Memorial Day. One of the things that we do is we provide the flags and the markers for the cemeteries. So we have veteran service organizations, VFWs, American Legions, and some people who are sextons, cemetery people will go out there, put those things in and put the flags in. We have them on from Memorial Day till about the 4th of July. And, we do that because we try to conserve as many of those flags as you can. You can maybe get 2 to 3 years if you do it that way and not over the entirety of the summer. So that's coming up. We just sent some stuff out to all of our contacts. We've started to go to Grace Place every Tuesday to try to get on the front end of any veterans who are encountering some homeless issues. I think that's been a good step that we've done. Instead of kind of learning about them on the back end, we are making the contact. We're going in there and we're trying to hit them on the front end so we can maybe help them get some of those compensation and pension dollars or anything along those lines. We also go to Hammond bi-monthly. Hammond has a VA contract for nursing homes for veterans. There's quite a few veterans that are there based on a VA contract. So we'll go in there. We'll give them some chicken. They love chicken and mashed potatoes. Paulette Anderson goes, helps me scoop it up, and we have a good time. And we also just kind of talk about their service, just want to try to improve their lives while they're there. One of the very cool things that we did was we got some donations from people within HHS and most of the veteran service organizations around. We sent out 80-plus care packages to the 128th. We sent the first round around Christmas time. Second round we put out in February, and then there was just a final push that we just had 7 or 8 packages that went out. And so we're trying to, also think of the people who are deployed. And that was a real big success. A lot of people really connected with that, wanted to give as much as they could, either financially or donations or, they're going to be the cleanest people that you've ever seen because we got so much soap, you wouldn't believe it. So another thing that we do is we do transportation to the VA. That is coming up where we're going to be getting a new van. We've had that van for 7+ years. It's 100,000 miles, and it's gotten to the end of its life cycle. Talked to the people through facilities. It's on the KIP plan. Talked to the people through the VA in Minneapolis, through the voluntary services now called CDCE. And they said, yep, you're good to go, no problem. Get that thing and get that over to us, and we're going to do that. That program, how we have it structured, has saved the county quite a bit, thankfully, because we're dealing with the VA van, right? They pay for the gas, they pay for the insurance. It's just a win-win, and we didn't have it that way before. That was one of the undertakings that I took in when I kind of first got on board, and I think that everybody, all of our drivers, we did a push. We're up to 13 drivers now, so it's great. We don't have those staffing concerns with those drivers, so that was a big victory as well too. Yeah, so let me see. I don't think that I really have to. I mean, the governor's budget came out. There are some veterans stuff that's in there. I know that they're prioritizing the Veterans Outreach and Recovery Program. That's a WDVA program where they're trying to have folks who kind of deal with homeless and mental health stuff. They're trying to make that fully funded. A few other things as well too, but you never know how those are going to shake out, right? It's a mess down there. I'd be willing to take any questions. Do we got any questions for me? I'm under 45 minutes. I do know that. But.
So does that proposal that's in the state budget, does that provide, I worry about veterans and suicide because they have a higher rate instance of suicide. Mm-hmm. And I know that, I think we've done some programs in the past, or I know you've done some outreach, but maybe you want to elaborate on stuff you've done in the past and what maybe you will be doing? Sure,
yep. So we've done, there is the 988 number for veterans who, are undergoing some mental health concerns and that they can get those addressed. I know that there's some questions about those funding and people getting laid off that provide that service. But so as far as, mental health, the question persuade, QPR is what it is. I can't remember what it is. We've done things like that around but in reality, I mean, the VA is on the cutting edge for mental health, and that's why we feel it's so important to provide that service over in Minneapolis and to get people over there as an option. They have online options through them. They also have the La Crosse Vet Center for folks who have mental health concerns that were in combat situations. They do telehealth as well too, so transportation might not be necessary for folks who use those things. Yeah, it is a concern for sure. It always is. It's nationwide, unfortunately, and veterans are a part of people who, there might be some specific traumas that they're dealing with, unfortunately, but it's a nationwide issue for sure, and it's nothing to not focus on, but also, you'll want to try to get these folks better, however you can. I don't know, some of the events that we've done, 2023, I believe we did at the New Richmond Armory, we had a big event there where we had about 500 folks that came over the last 2 days. Never going to do a two-day event again. That was a learning experience. But, you know, I'm planning on doing some kind of smaller event. I think that I've had contact with post 9/11 coordinators and stuff through the VA where there are certain people that aren't using the VA healthcare who are eligible for it. So what we want to try to do is kind of connect those people in with the VA. It's free. And, you know, hey, let's see that. And we're probably going to do like a smaller type of event, kind of more intimate, and sending emails to folks and stuff like that through the post 9/11 coordinators. We have a few things that are in the works. So, yep.
I assume you work with the VFW and American Legions very closely.
Yeah.
How many VFWs posts are there in?
Well, there's two in St. Croix County, and I think that there's 11 American Legions. I think that it comes down. There's also a VVA that's right on the border, kind of in River Falls. So yeah, and let me just sing their praises for a while too, because you know, in those care packages, a vast majority of those donations came from the VFWs and American Legions and folks like that. Also, there was a financial donation for the first round of the $700 or thereabouts. Those suckers are not cheap to send over, and they said we'll cover the first round. You know, so it's just a fantastic. They do great things. One of the things that the VFW is doing in New Richmond, they're trying to build that Freedom Park Center. They did just get some updates on the outside of it now, and it's a big structure. Now they're going to be going to phase 2. The VFW post in Hudson, I actually just did last week, I think on Thursday. I was there doing a talk on benefits, and I was there for about 45 minutes there. So, but yeah, I was there, and we talked. They have their meetings at Bill's Gun Club there, the gun range. So I went there. You know, biggest thing is that, you know, and the American Legions, VFWs, they're all doing their independent kind of thing. They've got their niche. Sometimes they're going to be doing, you know, bingos on Friday nights, or they're going to have a chicken fry, or they're going to do some fish, or do whatever, or some of them have bars, some of them don't. And, you know, so whatever it is that they do, I think that we have really fostered a good relationship with them, and they know that we have their back, and we will do anything that they need from us. You know, I started like a coalition type of thing a couple of years ago, where I send out emails to everybody, and then I also invite them to, like, now it's a quarterly meeting, so where we can pass some word on some things, and then they can distribute that to the other American Legions and VFWs to try to make sure that everybody in St. Croix County is getting the word from us that we get, you know. And, you know, they like, for example, the American Legion in New Richmond, they had their gun show at Ready Randy's, I think it was the 16th and 17th. They have, you know, it's a big money raiser, and they do good things with the money that they raise. So I would say, if you see somebody out there that's trying to sell a poppy or whatever, if you do have some money to donate, it's going to go towards a good cause for sure. Yeah.
And I want to thank you for the flags for the cemetery. I'm a president of a small cemetery also.
That's
so-
right. We had that conversation last year, I think,
Yeah,
right?
yep.
We're glad to do it. We're
Yep.
glad to do it.
Thank you.
You bet.
Any other questions? Thank you, Phil.
I missed that one. Sorry.
Review of public health fee schedule.
Yeah, thank you, Mr. Chair. Yes, I've asked Lori Diaby to come and speak about the proposed fee increase for environmental health, so I'll turn it over to you.
Good evening, everyone. We come every year. I will rely on Faye as well, because Faye is the one that does all the number crunching with us. But you have a 3-page document in front of you. A portion of our environmental health program is we have agent contracts with both Department of Agriculture and DSPS to license and inspect a number of different types of facilities. We're up to almost 700 in the county that we license and inspect. And this program is fee funded. We watch the fees very closely so that we're not taking tax levy to run the program. And so that's why we come before you every year and look at the fees. This year, it's looking like all we'll need is a 1% increase on the fees, which, as you're aware, you know, with salaries and benefits, the reason that we're able to keep it only at 1% is we do have a growth of facilities in the county. So that's how we can keep the fees only at a 1% increase. I don't know if there's anything specific you think we should point out on the fee schedule, or if any members have any questions. Deb?
Are there any new facilities that you're inspecting?
Any new facilities?
Any new type of facilities at all that you're inspecting, or that?
No, the contracts, I mean, part of what we do each year too is we do make some fine-tune adjustments because we align our license categories. There's a lot of them, as you can tell. We align them with what the state has so that we're looking the same as Polk County. You know, all the counties are the same as far as license categories. Probably the newest ones that I can think of is a trend is micro markets, but that's been on our fee schedule for 2 or 3 years now. They're a facility type that's sort of like a vending machine on steroids. You kind of like walk into an area instead of putting money in. It's kind of like a little mini store. That would be a new type. We're getting, as far as trends, we're getting more and more tourist rooming houses, they're called, which are like Airbnb kinds of facilities. We always have an increase in those every year that are in the county. I'm just scanning here to see. We have, with the concert venues and the outdoor events, we have quite a few food facilities that we license as transient food facilities with that. The tattoo program with DSPS and tattoo and body art program. See, we're at 5, 6, we're at 20. So there's not been a significant growth in that, but we have within that category, probably the popular license type is permanent cosmetics, is people that get their eyebrows, it's actually tattooed, then it's more permanent. They call it permanent cosmetics. But yeah, those are the things that jump out at me that are kind of like trending or different. A lot of restaurants, a lot of food facilities. Yep.
Excuse me, do these fees cover inspections? Is that what they're for?
Yeah, they get, with the way we calculate this, every facility gets 1 routine inspection a year. And then we have re-inspection criteria that's defined by the state. So if we see types and kinds of violations in the facilities, then that generates re-inspections. And they get, it's not 1 free, but built into our fee schedule is they would have 1 follow-up inspection that is calculated in the cost of their annual license fee. If we have to go out more than once for the same violations because they didn't correct it, then they get charged an additional re-inspection fee.
Do you revoke licenses very often?
Not very often. Occasionally. I don't have any data or statistics on most of the facilities. The criteria that we have, what we might call a critical violation, is most of those types, we want to correct them on site immediately so that the facility can stay open. The ones where we have probably more temporary closures are swimming pools, because there's very specific chemical, their water quality has to meet certain, and so sometimes we go there, we have test kits that we're testing different parameters in the pools, and if it's not within a certain acceptable range, they have to close the pool until it's corrected. So I would say that's the most type of closure that we do is swimming pools, but it's usually pretty temporary. They might be able to get it corrected within a couple of hours or the next day.
do we need to approve this? Okay. Pardon?
Mr. Chair,
Yeah, go
I
ahead.
move to approve the proposed 1% increase in fees.
Is there a
I
second?
second it.
Deb seconded. Any other discussion? Hearing none, I'll have a roll call vote.
Aye.
Kathy Leaf,
Aye.
Lisa Lind,
Aye.
Deb Lindeman,
Aye.
Julie Smith,
Aye.
Greg Telejohn,
Aye. Motion passes. Thank you.
Thank you. You have a good night.
Last item on business, tick surveillance program findings. That sounds like an interesting subject.
Yeah, I'll try and take this, Mr. Chair. At our last meeting, Paul Lauby from Environmental Health came and did a presentation on rabies. And somehow as a part of that, there was a discussion about tick-borne illness and a tick drag that he was taking part in. And he didn't have the report at the time on the outcome of that tick drag. So he provided the report, but he wasn't able to come and present on it. And I thought I would, and someone at the last meeting, I'm not remembering who, requested that we bring the report when it was. Dr. Finley did, okay. So Dr. Finley requested that we provide the report when it was available. It became available, but Paul couldn't be here tonight to present it. So I'm just going to give my interpretation of the findings as best I can, and if you have questions, I'll ask Paul after this. But it looks like from the sample of ticks collected from the drag that he did, had within that sample, the ticks had the expected amount of tick-borne illness that they identify in this report in that sample. So there was nothing unusual that I can see from this report that would indicate there was any higher level of tick-borne illness than what you would normally expect to find in this area. That's my interpretation of this report. So if there are questions, you know.
Who did they drag through the field?
Yeah, we usually use interns, and we drag them around. Yeah.
Do we do this annually?
Well, that's a good question. Do you know, Lori? Yes. Lori says, yes, we do.
We started participating. We started participating in this, I think this coming year, 25, will be the third year that we've done it. It's a state program that was in our western region in St. Croix County. There was not any representation in the samples they were collecting, so they were very interested in our participation in the program. And so, yeah, it's a good thing, because tick-borne disease is an issue, and it's trending changes in the types and kinds of ticks that are moving around the country. And so it's a way that they can, get surveillance data on what's happening out in the woods, in the long grass. Yeah. Yeah.
So when was this tick drag? When did this happen? When?
Did he put them in there?
I didn't see it in here, but
He
maybe.
went out multiple times because there's a minimum number of nymphs that he has to collect that's in order to be a statistically significant. And so he went, it looks like 2 places last year, and went multiple times. And there's certain times of the year that are easier to collect them, and so he would go there, and I don't know, it's like a big board that has sticky stuff on it, and they walk through and try to get the ticks on it. Yeah, yeah, yeah.
Any other questions? Thank you. That ends the business items. Request for any future agenda items? No. Announcements. There's a county ambassador program, which I'm a part of, and Kristen Newton is, and Ken is, we're heading to Madison next week to lobby for Health and Human Services in Madison next Thursday, I believe. So hopefully we'll make some good contacts. Any other announcements?
Just with that, that was one of them. But the other one was to let you know that Ellie Clausen, our public health officer, is on maternity leave and will be until June. So I'll be serving as the interim health officer if needed.
You're a stunt double.
Yes.
He'll be doing the tick drag.
Yeah. So I'm in charge of tick drags from now on. But Ellie has had a baby boy and is doing well. So just to let you know. The other thing, just real quick, if I could, I wanted to appreciate first of all that our staff came, Jessica and Lori, to talk tonight. But when Phil was talking, and he's talking about having the backs of the other organizations that he works with, but he really, what I appreciate about him is he stops by my office every now and then, because his department's located at the services center. So when he gets a minute, he'll come over. And Phil's attitude towards our just our way of working together is to ask if there's anything we need. And I think, and of course I reciprocate that, I hope, and say, we're willing to work with you on anything that would benefit both of our departments. But it's just his integrity and his leadership there that I think really shows through when he's probably overwhelmed with work as it is, but he asks if he can help, which I think is very, telling of his character. And I appreciate you coming tonight, Phil, and for talking only as long as you did. That's all.
So are you going to put him in charge of tick drags now, or?
Yes, we'll partner on it, yeah.
If there's no other announcements, our next meeting will be planned for April 16th. And I will adjourn the meeting. Thank you, everybody.